Hello and welcome to Nature Change. My name is Dave Poinsett, and today we're talking about healthy communities and the environment. We're very pleased to have some special guests to discuss that with us. We have Kathy Birdsall, a registered nurse, Jill Polmateer, nurse practitioner, and Jeanine Easterday, registered nurse and former Traverse City City Commissioner.
Hi.
Hi, it's good to see all of you.
Hi there.
So, Kathy, let's start. I'm curious, what's the connection between all three of you on this topic of healthy communities and the environment?
We all are members of our professional nurses association called the American Nurses Association. We are the Michigan chapter, so we've known each other for many years.
And so there's a local chapter of that organization?
Yes.
I happened to read the ANA statement from 2008. I don't know if there's a more current one, but there were some very strong resolutions concerning climate change and the environment. Can one of you talk about that a little bit?
The American Nurses Association has a number of position statements, but I think basically the core of that is that nurses are committed to ethical practice, that we have a code of ethics by which we function. So from the individual one-on-one interaction at the bedside to the community to our own requirements, if you will, our own commitment to global world health, we are all committed at various degrees.
So Jill, what are some of the components of this, the health components for a healthy community in the context of the environment and climate change?
Some of the things that I've seen is that the seasons where we are right now with spring and fall is always when I always saw people have those seasonal changes with their asthma and allergy exacerbations. And it used to be that it was a pretty finite 2 to 3 week span of time, and that's grown into more of a 4 to 8 week span of time that they have exacerbations. So it's a longer period of time.
Jeanine, what kind of things have you seen?
Well, I think coming from a more political perspective in terms of what's going on in our community, I see continual devastation of trees. I mean, even just this week driving down 8th Street and seeing a clear cut on at the corner of 8th and Boardman. I think Morgan Farms is another example of trees being cut down. And I know the city, along with some people from the Watershed Center, have been working very carefully to not only try to protect and save trees, but to replant trees. But still, no matter what you're doing when you're replanting a tree, you're not getting the same tree canopy that really protects us and protects our environment. And I think we have, because of our history, we have had a lot of trees, we have had a lot of protection, but now especially in our local community, we're seeing a lot of development. We're seeing a lot of impact on water and water quality, on our lake shore and our beaches in terms of eroding, even the Boardman Lake. And there's a difference between the Boardman Lake in more rural areas and the Boardman River in the developing area. So all of those kinds of things really affect our environment more than we sometimes believe initially. So what I see is that as we are developing, we are diminishing our ability to offset some of those carbon changes that happen because we're a more developed area than we were maybe 20 or 30 years ago.
Kathy, you talked about the organization, the nurses, the
Yes.
ANA. To what degree do the healthcare professionals in our community embrace the ideas that we've been talking about here?
Well, just having that new committee at our local hospital, Munson Medical Center, has been a big achievement. Dr. Lisa Del Bono, who is a pathologist there and is the chair of our local chapter of the Citizens Climate Lobby, told me, I believe last meeting, that she finally got it in writing and that the administration of Munson Medical Center was completely committed to not only educate about things that are not on their campus, but to deal with the things that are happening on their own campus as far as sources of energy, as far as recycling and waste and things like that. So, you know, that's very heartwarming to Lisa and I, and it's good to know. But there's just so much more. Nurses are born educators, so we tend in our own families and friend circles to try to bring up the human factor of causality, and lead by example, because we as nurses know that one of the best ways to educate someone is to be a good example yourself.
I would just like to add, in terms of commending Munson Medical Center for their efforts, because they haven't just internally done a lot of work in terms of recycling and use on their various opportunities on the green team, but when they created built the Cowell Cancer Center, they created a green roof, and they have worked extensively with the Watershed Center and the DEQ and other partners to daylight Kids Creek, to plant natural vegetation that encourages animals and contributes to a healthy stream bank and a healthy stream, and then going back into where the commons area is to try to take the Kids Creek off the impaired water list.
You've talked about nurses who have embraced this idea locally, doctors as well. Mm-hmm. So it's kind of across the board and it's happening. You talked about education. Jill, when you're talking with patients, to what extent can you address the climate change or the environmental aspect of what's affecting them?
So I usually start with looking at their seasons and what is affecting them, and try to figure out, you know, is it spring, is it fall, and start with some problem solving in their dates. You're not going to change the weather, unfortunately, but you can change what's in their environment. And so I look at where they live and what's in their living space, and look what's growing around them, cleaning up debris in their yard. The more and more that we're getting into reading, you want to go with the native plants as much as you can, and you're seeing much more. But that's really a newer concept than, you know, that's really been the last 5 years or so.
It seems like when those kind of things affect us personally, and you can make that connection to climate change, it has more impact than, you know, hearing it in an abstract way on the news and on it.
And you know, you don't have to be nasty about it. We can listen to each other, we can understand each other, we can share information. And granted, there is misinformation in all areas. So I think it's important for us to become, Kathy referred to it, we're good researchers as well. And it's important for us to be able to help people understand the difference between what's fact and what's not fact, and how to read information and understand information so that we can make the best decisions for our own health and the health of our communities.
I think that's a great note to end this on. Thank you all very much for having this conversation. I think people are going to get a lot out of this. Thank you.
I hope so.
Thank you
very
welcome.
much.
It's a lot of fun. And thank you for watching Nature Change.